Hi, I am Dr. Michael Lewko with New Jersey Arthritis and Osteoporosis Center. I received my medical training at the Hospital of University of Pennsylvania and have been treating patients with moderate to severe rheumatoid arthritis for the past 25 years. Recently, we discussed adding a biologic to your current treatment to help relieve your pain, stiffness, and swelling of your moderate to severe rheumatoid arthritis. This is an important step in your rheumatoid arthritis treatment journey, and in making this decision, I encourage you to take the time to consider your options. Learning everything you can about your biologic treatment options, including how they're taken, all safety considerations, and how much they cost, may help you feel more confident when deciding on a treatment path. I understand that office visits can be overwhelming, and remembering the information we've discussed can be difficult. That is why this video was created. You can now watch this video and consider the different biologic treatment options we've discussed at your own pace, in the comfort of your home, and as often as you like. You can also share the video with your family and friends so they can better understand your treatment options. In this video, I will review 5 key elements to think about: the benefits of biologics as a treatment option for RA, important safety considerations, the different ways they can be given, affordability and financial considerations associated with these treatment choices, and a few things to think about when considering which available brand option may be right for you. It's important that we work together to determine which treatment options fits you and your lifestyle. This video is designed to help you do that. As you watch this video, use the tear pad I have given you to write down any important things you would like to discuss. These could be questions you may have about your treatment options or thoughts about how a treatment option may work for you. Open and ongoing communication is an important part of an effective treatment plan and can help us meet your treatment goals. First, let's discuss the benefits of biologics. As with other RA drugs, biologics do not cure RA. Biologics work by helping to relieve pain, stiffness, and swelling in people who have not fully responded to DMARDs such as methotrexate. Many biologics are often taken with methotrexate. Now let's go over some of the safety considerations with biologics. Biologics are medications that affect your immune system and can cause some serious side effects. We'll discuss whether biologic treatment is appropriate for you based on your medical history. Before beginning a biologic, your health will be assessed and you may be required to have certain tests. We'll talk about which vaccinations you should receive and the best time to receive them. We'll also go over all possible side effects of biologic treatment. Next, I'll review some of the different ways your biologic treatment can be given to you. Depending on the medication, biologic treatments can be administered or given as IV, also referred to as infusion, or by self-injection. Receiving an infusion and self-injecting are 2 different experiences. Both ways of receiving your biologic medication are for moderate to severe rheumatoid arthritis and deliver the medicine where it needs to be. The decision we will discuss together is which option would best fit your lifestyle. An IV or infused biologic treatment is given in my office. The medication is delivered through a needle that's placed in a vein, usually in your arm. Depending on the medication, the length of the infusion can be 30 minutes to several hours, every 4 weeks to less frequently. Before your infusion, we'll check your vital signs and health to make sure that it's safe for you to receive your treatment. Then, the infusion suite nurse will prepare and give you the infusion. You'll be monitored during and after treatment. Self-injected biologic treatment is usually done at home. After a nurse or I have properly trained you, you will inject the medication under your skin, in your thigh or abdomen. The frequency of injections will depend on the medicine, but the range is usually once a week to once a month. You'll receive your treatment in an injection device that's pre-filled with medication and which needs to be stored in your refrigerator and disposed of properly after your injection. If a self-injected biologic treatment is right for you, we'll make sure that you feel comfortable self-injecting, storing, and disposing of the medication, as well as monitoring yourself for signs of infection. Now that we've reviewed 2 different ways to receive your medication, take some time to consider how the different aspects of each option may best fit you and your lifestyle.
Affordability is another key consideration when choosing a treatment option. You may have some questions about how you will afford your treatment. The first step you should take is to carefully review your health plan's benefits and explore options for cost support, since coverage requirements and out-of-pocket cost can vary. If you have commercial or private insurance, biologic treatment may be covered under your plan's medical or pharmacy benefits, or both. Your cost can vary depending on how your treatment is given. You may also be eligible for out-of-pocket cost support offered by the company that makes your medication. Medical benefits usually cover infused or injected biologic treatment that is given by a healthcare professional. Pharmacy benefits usually cover biologic treatment that you inject yourself. If you have Medicare, biologic treatment may be covered under Medicare Part B or Part D. Your cost can vary depending on how your treatment is given. If you need supplemental assistance, there are foundations that may be able to help. Medicare Part B usually covers infused or injected biologic treatment that is given by a healthcare professional. Medicare Part D usually covers biologic treatment that you inject yourself. If you do not have health insurance, you may find help through a private foundation.
The affordability and financial considerations of treatment options can be a lot of information to digest. My office can assist you with questions about your financial options. So far, we've reviewed the benefits of biologics and the safety considerations, the IV or infusion experience, the self-injection experience, and some financial considerations associated with biologics treatment. Our final consideration is which of the biologic brand options may be right for you. Together, we will discuss the available brands and make a decision based on our shared knowledge of your condition, general health, preference, and health plan coverage. Moderate to severe rheumatoid arthritis is a chronic and progressive disease that requires frequent monitoring and a long-term commitment to taking medicine. That is why it's important that we work together to find a biologic treatment for your RA that you are comfortable with and that you can consistently and successfully follow to help manage your condition. As you think about what we've discussed in this video, it may be helpful to ask yourself the following questions. How often is treatment given? How many infusions or injections are there per year? How long will my IV or infusion treatment take? How long will my self-injection take? Will the self-injection medication be delivered to my home? How will I store it? Will this treatment be covered by my insurance? How will I pay for it? Is there a support program I can turn to if I have questions or need someone to talk to? Thank you for taking the time to watch this video. Remember, the more you know, the better prepared you'll be to manage your RA. I hope this video has provided you with some helpful information as you consider your treatment options. You may also want to check out the additional resources section of this video for a listing of organizations that may assist you in learning more about RA. different ways to connect with people living with RA, as well as RA advocacy groups dedicated to helping patients like you. I look forward to continuing our discussions and sharing this important decision with you.